as you see, you're going to see the entire OLLIF procedure from the beginning to the end. And you saw the 2 C-arm technique. You cannot do this surgery this way with 1 C-arm. You can do it with 1 C-arm, but you lose most of the benefit of efficiency. As Varun showed rightfully, the space is just right for 1 surgeon, but that's all you need. Your assistant, as you see, is on this side, and she's a very experienced assistant. Let me see if I can activate. Yep, here it is. And practically, what you see here, I put the first K-wire. You see the neuromonitoring, and on top here, you see, for some reason, this is not really working, the laser here. Okay, let me see. Oh, this is not the laser. That's why it's not working. So here you see the tools are used. Here you see actually the AP and lateral picture. Here you see the neuromonitoring. And I always use neuromonitoring. This is not a procedure you can do without neuromonitoring. This is your eyes. And in the United States, half of the people, half of the spine surgeons use neuromonitoring, half of them don't. Your choice, but not for this procedure. For this procedure, you do need neuromonitoring. So I start first by putting a Jamshidi. So we are starting the surgery now. Time it. We are putting a Jamshidi needle. I take first 5 cc of the bone marrow, not blood, bone marrow, because after 5 cc, whatever you take is blood. We have counted the number of the stem cell. After 5 to 7 cc, you drop like 90%. So it's more or less venous blood you're taking. But the first 5 cc had a lot of stem cells. So I've mixed that with our biologic in a very specific protocol. We will share it all with you. And that gives the mode adherence of the stem cell to the particulate tricalcium phosphate in the collagen matrix. Now, what you see now is actually that the Jamshidi is in, the bone marrow is going to be taken out, and now the next step is actually pay attention as well to neuromonitoring window here. The next step is actually to put a, and again, we don't use Bovi, we don't use bipolar, we don't use a suction device. We measure, we have sponges, we use only sponges, we weigh them before and after. That's how we calculate our blood loss, which is usually about 45 cc per level. Usually, that's what it is. After 1,600 cases, only 3 patients have gotten blood transfusion, but those were patients that got a 4 or 5 level fusion, some of them even with coagulopathy. As a matter of fact, you know, those were not a candidate for open surgery at all. So here what you see is, I'm going to go maybe to show you, you saw the neuromonitoring probe going there, and now a K-wire went in. Over the K-wire, a dilator get entered. And here you see that over the dilator now, a tube, the Varun had much better pictures, it get hammered in. And now, as you see, we are introducing the cannula, which is 8 millimeter inside, 10 millimeter outside. And now here you see that actually the actual dilator comes out. The drill goes in. If you remember in Chennai, I told you be very careful with this step. The drill creates a path, and then a series of very specialized tools go in and perform a discectomy. I think Varun can agree with me. If there is a disc you need to take out, you can take out with these specialized tools. And as you see here, now these tools are now in action. These are again very specialized tools that enable you to go through a 8 millimeter cannula and perform a discectomy. Now, at this point, I packed the space with tricalcium phosphate in a collagen matrix soaked with bone marrow, and you will see that space will go dark because it has a high density. Now, what's important is this material that I use. You see it went dark. after 12 minutes, it has the consistency of gel foam. As a matter of fact, some of the residents and fellows in Chennai, I ask you specifically if you remember to touch it. It has the consistency of gel foam, meaning that even though if you get a CAT scan, it may extrude out, it cannot provide pressure because it has the consistency of bone marrow, of thrombin gel foam, but in the CT, it looked like bone because it's tricalcium phosphate. So you see another device, the loop cutter. Varun, I will help you to get that because that enables you to go 14 millimeter in each direction. My next present for you will be this one because that makes the life so much easier. And as well the articulating curette. So I know what I'm bringing next time to India. This is one of my favorite tools. Practically what you have, you feel the high frequency vibration when the metal is on the bone. Then you know you have done a good job for the preparation of the end plate. And again, this is continuously running. You only need EMG. You don't really need SSCP or MEP. EMG and stimulation is what you practically use. Now, as you see, we go with the articulating rake up and down and prepare the end plates. And then the pituitary, long pituitary is very useful tool. And I saw how you're using it. I use it exactly the same way. You go to 4-quadrant, backhand, forehand, and perform practically the discectomy. At this point, you will see that we are going to put bone marrow with the tricalcium phosphate. Then we put a K-wire, then the tube comes out, and the next step is the cage is going in. Now, I'm not sure if you timed it or not, but can anybody tell me from the time I told it we are starting, how many minutes it has been? It's probably around 7 to 8 minutes. In 7 to 8 minutes now, the cage is going to go. Now, the cage, you go through the fascia, you just gently dilate it, you let it sit on the capsule and then gentle tap to make a divot in the capsule. But then, once you're there, I bend the K-wire and now a big, first this is the gentle tap and then the big hammer and then you just have to hammer it in. Don't play around at that point. And here you see, now here, there's a technique I will show you tomorrow more. I go at 90 degree in the wrong way and then I turn it 90 degree to make it the correct way. Practically we call it in situ rotation. We make a static cage to expandable cage. So if we go at the 9 millimeter profile and as you just saw, we turn it and it opens up the space. Then I don't have to deal with all the mechanism, small tiny mechanism of expandable cage that half of the time they have failed in my hand. So the cage is in. As you see here, I'm packing the holes with the some sponges, and we measure them before and after, and we are looking at neuromonitoring. It is normal right while you are going in to get about 10 to 20 seconds of signal. That's normal. Then it slows down and it goes away. Warren explained that 3 milliamp when you go in, when you are in the Kamin triangle, 4 milliamp. So the cages are in, and as you see, two of the guide wires, the K wires are in and then I just have to put two more Jamshidis, 2 more K wires, and then pass a rod, and then we are done. So being able to do this surgery, literally from the beginning, you are seeing the surgery in actuality. This is not sped up, or this is not, we are not skipping any sequence of this surgery. This surgery was skin to skin in 25 minutes. And as Varun can say, Varun was saying half an hour. Well, yes, we spent another 5 minutes to close the skin, but more or less, you're seeing this surgery in actuality. So, and here again, putting the Jamshidi again. One of the things I think we observed that with 2 CR, putting the Jamshidis in it becomes so much more easy and more straightforward. And as you see here, the Jamshidis are in, the K-wires are in.
Sorry, you have to conclude. We are already late.
You are done with the time. So there's really not much to see here. The rest is putting the rod, and then we are done. Now, I'm going to answer a few questions, if you have few questions. But before we do that, as a token of my appreciation for Dr. KK, who really went over the board, and I'm so thankful to introduce me to your fantastic team. I saw that your team as well really appreciated that decortication device. So I have another of that for you and your team. I hope you guys in the next year put it to excellent use. Thank you so much again for everything you have done. Thank you. I appreciate it.